Good afternoon, and welcome to the webcast on news4jax.com, where we're talking about your health. Sitting with me is Dr. Arun Gulani, world-renowned LASIK surgeon and inventor, and we'll talk about that in just a second. We're going to talk about your eye health, whether or not you're a candidate for LASIK, whether or not it's a financially right move for you. So, Dr. Gulani, let's start with some of the basics. People have heard the term LASIK, and they really don't understand or know what it means. They know what it is to wear glasses. They know what it is to wear contacts. What is it when you perform a LASIK procedure?
LASIK procedure, Bruce, like you rightly said, it's one of the most commonly used names, if you may, of a surgery that is actually just one among many laser vision surgeries. So the word LASIK has become as famous as FedEx or Xerox, if you may. So LASIK surgery is where we shape your cornea with a very advanced laser technology, which actually sculpts the shape of your cornea within minutes, and then we put the flap back and you start seeing, which is if you were nearsighted, farsighted, or astigmatism. Now, what is very important educatively, which we are sharing today, is LASIK is just one among numerous laser vision techniques that can be designed for each patient separately. So we can do surgery even without cutting flaps, without using blades, and these advanced laser techniques are available. These are again part of actually what I call vision corrective surgeries, which includes laser, lens-based surgeries, even combinations. So there's a whole wide spectrum available today for so many people to have their vision corrected and safely and for great long-term outcomes.
You bring up an interesting point. One procedure is not tailored to everybody.
Yes.
And that's why it's important that you're an educated consumer when you come to the doctor. So I come to you and I say, Dr. Gulani, I've been wearing glasses or I've been wearing contacts for years. And you know what? I'm tired of putting them in the morning. I'd like to, see what's going on around me. When I first wake up, I'm looking to see what's going on in the world around me when I'm playing sports and I can't wear my glasses. What do I need to know to find out if I'm a candidate for LASIK?
I would even take it to a step higher, Bruce. I would even say the patient shouldn't even say, am I a candidate for LASIK? What they should just say is, I wear glasses and contacts, doctor. What's the best procedure for me? That way, you're not narrowing down to something that may not be the ideal choice for you, right? So let's say a patient comes and says, I wear contacts, glasses, doctor, I'm tired of this. What is the best thing for me? By asking that question, what they're asking their doctor is, tell me honestly, what's the safest thing for me? What is the best technology application for me? And what is the best thing long-term, keeping my profession and vision requirements in demand?
And your health and safety is indeed the most important thing. So that said, what are the key questions that the consumer, and make no bones about it, you are a consumer when you come in and you're asking about a LASIK procedure or an eye corrective procedure, what are the main questions that you should ask your doctor?
So the first thing is, like we said, what is the best technique or technology for me? And then if that's LASIK, great. What kind of LASIK are you doing on me? Why? 2, what are the side effects, complications that can occur with this particular surgery, even though it's very minimal? LASIK is, by the way, one of the most successful surgeries ever. But there are side effects, complications if done in the wrong cases. And then, doctor, what are the long-term outcomes? If something goes wrong, how can it be fixed? Can you fix it for me? Or will I be shipped somewhere far away? Then, who is doing my preoperative evaluation? Who's going to do my surgery? And who's going to see me post-op? Very important. Your surgeon should be fully involved in this process because only then is the accuracy consistent. Plus, you've been taking care of somebody who knows what happened during surgery. So to me, these are vital aspects of how you can avoid complications, side effects, and doing the wrong technique from different people.
Now, you brought a model here of the cornea of the eye. People know that when you wear glasses, basically the shape of the lens acts as an artificial way to go ahead and reshape your eye. If you wear contacts, it does the same thing. Show me what these LASIK procedures do to your eye in an effort to improve your vision.
Now, the simple way to look at this, we have computer models, but I think this is a great way to explain. Your eye is like a camera. In this camera, basically, the shape of your cornea decides your vision. If you're very curved in the cornea, what we call very steep, you are nearsighted. If it's very flat, you are farsighted. And if it's shaped like a football as opposed to a basketball, you have astigmatism. Now, additionally, don't forget, you have a lens in your eye, very much like a camera. This lens needs to be clear, meaning you're young enough to have laser surgery, because laser does nothing more than shapes this cornea to a perfect shape so you can see without glasses. So that being an important point here, if this lens in your eye is cloudy, is an early cataract, then you rather go and remove the cataract and do a surgery rather than LASIK. So as long as the lens is clear, you can shape the cornea with LASIK, and that's what makes you see.
Is there an age threshold? Is there a point where, because there are a lot of kids, you know, who don't want to wear glasses and don't want to wear contacts, and they ask their mom and dad about it, where the person's eyes stop changing dramatically and they become more of a candidate for this kind of procedure?
Yes. The minimal age by FDA requirements is 18 to 19 years, but more importantly, the way I teach LASIK surgeons to look at is, besides the age, also to look at the records over the last 2 years. Make sure there's no changes in the refractive error. And that is vital. Some people may change at 20. Then there are some pathologies which are caught because they keep on changing even beyond 20 years of age, like keratoconus. So it's very important not only to go by age, but again, look at the profile of the patient, see them once, twice if they're in that age group where things could change. Confirm that there is stability before going for surgery.
Same considerations on the opposite end of the spectrum for seniors?
No. You know, Bruce, we've done a show here where I've done LASIK on a 90-year-old. Actually, we've done just approaching a 100-year-old too. I don't think there's an upper limit for laser vision surgery as long as the eye is healthy. So these are patients, let's say, who had their cataract surgery years ago, who still have astigmatism in their cornea or are near or farsighted. They are pretty much a normal eye. So age doesn't matter. If you have capacity in your camera, you can have LASIK surgery. Absolutely.
Now, a number of you have sent in questions to ask Dr. Gulani here at newsforjax.com, and we've got some of those questions for you. And by the way, if we don't get to your question on the air today, rest assured that Dr. Gulani will have all of them, and he'll be in touch with you to find those answers. Also going to share a couple of very compelling stories during the course of this webcast that may very well answer you some questions. That said, let me go to the first question from one of our viewers. Rebecca from Jack's Beach says, I had LASIK when I was a teenager, and I've had trouble since. I'm 26 now and need to wear glasses. Can I get a new round of LASIK to fix my vision problems? So I guess the question really is, can we turn back the clock and fix those problems?
Yes, again. But again, Bruce, you know, the way I like to answer, always give logic with the answer. The first question I would have for this patient, of course, she has to be seen before you make an answer. Now, there could be 3 reasons for this. Rather than jumping in and thinking of how can I fine-tune or touch up this LASIK, you got to first think, did the surgeon, when he do LASIK, did not reach the goal? Is that the first cause? If that's the case, then I'll finish the job, meaning you'll get to the goal and make her see again. 2, did she have good surgery and the surgeon did a great job, but she has regressed, meaning her body reshaped the cornea a little bit? Then you fine-tune it. 3, are there changes happening in the eye that are unrelated to the LASIK, like age-related? They're hitting 45 and now they can't read, or they're hitting 60 years of age and they've got early cataracts. So again, if you see, Bruce, once you look at the patient and you analyze logically, the whole plan just unfolds in front of you. So once we see her, Rebecca, once we see you, we evaluate your eye, look at the safety parameters, and look at what aspect of your camera needs to be tuned or corrected. Yes, you can have the option again.
Again, going back to what we talked about from the very beginning, the treatment has to be tailored to the individual. You can't just say that there's a blanket treatment for